You need to submit all your certificates where you have attended all your courses, and you also need CPD summaries. Now, the GMC has an app called the GMC CPD, which is you can use on your iPhone or your Android, and that lets you keep a sort of online record of all the courses you attend, and it enables you to classify the courses accordingly. So I mean that's how I used it, and I think they kind of like it because it's sort of in a pattern that they're already familiar with. You need to send all the mandatory courses like the ATLS, the train the trainers, the management course, leadership courses, etc. Also examples of equality, diversity training in your routine hospital inductions. Keep a record of inductions at your hospital. If you change hospitals frequently, those can prove to be invaluable. You can get certificates of completing your inductions from the hospitals where you have attended. CPD registration points are basically you need to collect letters from your audit leads or your educational supervisor. Make a summary of all the CPDs for every year. You probably do need to do them in your annual appraisal anyway, so it would just be a simple matter of collecting and accumulating them. If you are from abroad and you don't collect CPDs regularly, your signed letter from your educational supervisor stating the number of CPD points should suffice for the same. Um, then it's also another idea for if you attend audit regularly, whether you can use that as a CPD. I mean, I did submit and this was accepted because in your audits you often do sit and listen to audits and material presented, and they are educational at times. Membership of professional bodies are fellowships and membership from the royal colleges, and if you have any medical malpractice defense organization, that can be used as well. Your teaching timetables will essentially the educational and teaching timetables of in your hospital. I mean, I had to collect them from everywhere, Singapore, from all over the globe, sort of wherever I worked. So kind of make sure you do that. If you've been in one hospital, then make sure you collect it and get it signed and stamped. You can also give evidence of journal club activities in this, or you can give details of some of the courses you have attended as well. Please bear in mind that any evidence you submit in all these sections, it does need to have your name on it, or at least part of your name on it, and it should be dated. If it's not dated and doesn't have your name on it, it will be returned. So that applies actually in throughout most of the evidences you submit. So make sure it's always done. Lectures. Now it's possible to get confused as to the potential difference between a presentation and a lecture. I mean, the University of Waterloo has actually a whole article entitled to dedicated to this subject. But to put it in a very simple context, the a presentation is basically a very shortened version of a lecture. And a presentation is usually 10, 15, 20 minutes or so. A lecture is something which you have given for a talk about at least 45, 50 minutes or so. So if you have given lectures particularly to students or medical students or to postgraduate students either or elsewhere, be sure to include them here. You need to provide the actual slides. So for all your lectures, you need to provide the complete slides of your presentation. You need to either print or upload them, and they need to be presented. Feedback and evaluation forms are very helpful. So anytime you do a teaching, keep the feedback forms ready and get it shown and submitted to them and get good feedback if possible. particularly if there. Some hospitals do give you dedicated feedback analysis. That's particularly quite helpful as well. Letters from colleagues, they can be anything from emails or text messages, or words. Just keep a written diary of compliments you have received. You can get them signed and stamped later. If you haven't gotten any formal letters, do not worry. Anytime you have been given a compliment, note it down, time and date, place and person, masking ID, of course, and as I said, you can get it verified later. Attendance at teaching courses, clearly the teacher is mandatory. If you are an educational supervisor for your region and have attended the training for that, that would be very helpful as well. Participation in assessment, appraisal, and appointment process include if you have attended, if you have been on an interview panel selecting junior trainees, or if you have done assessments of trainees, such as again PBAs, CBDs, or work-based assessments, or completed a DOTS form for them. All that can be included here. Now, audits, very important. They are a place where most people tend to fail. So you do need, they say you need an audit for every year, and so up to 8 years, and 2 of them should be re-audits with a complete cycle. The important thing about audit is they will ask you for your full slides of each audit, so make sure you get all the complete slides, and particularly including the re-audit as well. So I submitted about 7, so I took it as 6 for 6 years, and then I did an extra 7 just to be on the safe side, and this was accepted. Reflective diaries, it's a bit contentious at the present moment, given the issues which have gone on in the past year, but nevertheless, all your reflections and whatever you feel is optimal and safe should be okay. I gave a reflection about a consent issue and a post-op infection complaint, about my success in the exams and following my fellowship. Improvement, service improvement, and clinical governance meetings. Make sure you keep records and meeting minutes of these. You do not need to mask or the ID of all the people who attended the meeting. That's absolutely fine. As I've said before elsewhere, the GMC is particularly concerned with patient ID and confidentiality. For the rest of the doctors and staff, it doesn't matter as much. So keep a record of all this. Again, health and safety, you can use if you have attended infection control or safeguarding courses, they can be used. Your hospital often has infection control updates, so kindly use them. You can give evidence of your own health, immunization records, or you can declare the health on your application form. Attendance at M&M meetings also is accepted as evidence in this regard. When it comes to domain 3, which is communication partnership, you can have an appreciation letter given by colleagues. Email, again, as I said, emails which you will have from colleagues over the years which you have collected. Please use them as evidence and submit. They need to be signed and stamped. They need to mention you by name, and they need to be dated. Again, from patients, you can again use GMC questionnaires, or if you have been given any gifts from patients, they are acceptable. Now, I did call the GMC and check whether a gift was accepted, and as long as it was something you were not aware of, and the patient gave it in good faith and it was unintentional, it's perfectly fine, as long as you declare it. So I received a copy of a book and I've declared it here. Working in multidisciplinary teams. Now, this is where the partnership and teamwork, this can get a bit confusing because there's a lot of overlap here. So you can put a handover list of if so. I worked in an MTC where we had a rota shift system, and so there was a handover every 12 hours, and so those handover lists could be used as evidence. Um, Again, if you have been on committees or if you have been part of any associations or held any administrative positions, they can be. If you have also taken part in MDT meetings, usually orthopedic pairs up with radiology, or you can be part of the bone MDT meetings. Make sure you attend one or two of them. I also got a letter from my consultant stating that I was regular attending at the MDT. Management and leadership experience. You can give evidence of any committees you were, or if you were the quality leads of anything, or if you have been part of organizing a conference or a course. You can get letters from the supervising consultants and keep them as evidence. Again, for this, you need to, or you can even put attendance at courses. If you have attended management and leadership course as well, that's something that's also quite acceptable. For chairing meetings and leading projects, so if you have been part of and as an advisory role, or if you have been leader of a committee which is looked into any aspects usually pertaining to hospital related care, it's a good idea to put that on up here. And then we come to domain 4.